This is a patient, another patient with a relative afferent pupillary defect. This one is again on the right eye, like we had with the last patient. Remember, as a review, a relative afferent pupillary defect is really looking for a problem with the optic nerve. The pupil just tells you how the optic nerve is functioning. So in a relative afferent pupillary defect, if you have damage to one nerve and not the other nerve, the nerve on the damaged side does not send all of the information about the light intensity back to the brain compared to the other eye. So in this patient, when you shine the light in the right eye, the brain thinks the light is less intense than when you shine the light in the left eye. That is why the pupils come down less when you shine the light in the right eye compared to the left. In this patient, when you take the light away, both pupils are, say, 6 millimeters. If you shine the light in the right eye, both pupils come down to, say, 4 millimeters. Shine it in the left eye, pupils come down to about 2 or 3 millimeters. So you can tell by that the pupil defect is in the right eye. Now, is it a complete relative afferent pupillary defect or a 4+ RAPD? It's not, because when you shine the light in the right eye, the pupils do come down some compared to when the patient is in the dark. So it's maybe a 2+ or a 3+, and this patient actually does have reasonable vision in the right eye, but when the light swings back and forth, you can see that the pupils dilate on the right eye when swinging over from the left, and when you go back to the left eye, both pupils constrict. A great way to look at this is to watch only one pupil when you're swinging the light back and forth. So let's look at the left pupil. You can see it's 6, then it goes down to 2 or 3, goes down to maybe 4, 2 or 3, goes up, goes down, goes up, goes down. So if you're worried about this, you don't have to move your eyes back and forth with the light. You can just fix on one pupil and move the light back and forth while you're watching that one pupil, and that'll give you your answer. One thing to not be thrown off by is that this patient does have a little bit of asymmetry between her pupils. Her left pupil is a little smaller than the right, maybe 0.5 millimeter. It's not significant in looking for a pupil defect. In fact, you shouldn't have, or anisocoria, which is different sized pupils, shouldn't be a component of, or it's not a component of, a relative afferent pupillary defect. And a little bit of anisocoria is okay, it's physiologic, but don't be thrown off by that when you're looking at this patient.